Welcome to Stormont Vail's HealthWise TV, featuring interviews with area experts on health and wellness topics, and a low-impact exercise segment. HealthWise TV is produced by Stormont Vail Health and is made possible by the following local sponsors. AAA protects one of your most valued assets, your car, with everything from roadside assistance to insurance and trip planning. At AAA Kansas, we help keep seniors safe, mobile, and driving as long as safely possible through our traffic safety programs. Visit www.seniordriving.aaa.com. Aldersgate Village is a nonprofit continuing care retirement community with independent living, assisted living, long-term health care, and memory care, including Alzheimer's and dementia care neighborhoods. Our recovery center is for inpatient and outpatient physical rehabilitation. Contact our marketing office today for a tour. Caregivers Home Health and Caregivers Home Care, your locally owned and managed home health and private duty home care agencies. Whether you need Medicare certified nursing and therapy services or more routine home support services, one of our state licensed agencies will work to keep you safe and healthy in your own home. Jayhawk Pharmacy and Patient Supply, your locally owned and nationally recognized pharmacy and medical equipment provider, serving Topeka and the surrounding communities for over 60 years. Midland Care is a local not-for-profit organization offering hospice care, palliative care, PACE, a program of all-inclusive care for the elderly, home health, Thrive at Home, assisted living, and community grief counseling. Since 1978, Midland Care has touched lives through a range of healthcare services. Topeka Ear, Nose, and Throat. Breathe easy. We're on the case. Visit us at www.topekaent.com.
Good morning. Welcome into HealthWise, the TV show, and I'm your host, Ralph Hipp. In December here, and when sinuses are painful, can sure be miserable, and all of us need to think of everything of allergies, colds, or infection at this time of the year, anatomical issues that can lead to blocked or inflamed sinuses. Never fear, though, there is relief available. My guest for this segment is Dr. Douglas Barnes, and he is an otolaryngologist with ENT, Topeka Ear, Nose, and Throat, with how we can beat the sinus pain you may be going through. Dr. Barnes, nice to have you here on our HealthWise program, and good morning. What are some of the common causes of sinus pain that we have, especially this time of the year? Well,
this time of the year, we see many people who struggle with what initially is a viral infection. So we talk about viral upper respiratory tract infections. So much of the sinus troubles that people deal with in the winter time are viral infections. Also, we see a lot of people that experience, I would say, environmental sinusitis or environmental inflammation of the nose. People live in homes that are heated, and most times there's very little humidification during the winter, so that's another issue that comes into play.
Right. Are there some natural remedies, Doug, that we could use, some things we can do on our own?
Certainly.
And then we'll talk about medications in a moment. Absolutely things we can do on that.
Initially, obviously, prevention's important, so good hand washing, hygiene, those kinds of things. Trying to prevent viral infections is very important. From the environmental inflammatory changes that we see in the nose in the winter, one of the important things we can do is humidification, whether that's whole home humidification or even other types of humidification where we actually use nasal sinus sprays. Nasal sinus rinses are also very important. There's some rinses available over the counter that use sodium bicarbonate mixed with salt, and those types of rinses are often very helpful.
Some fairly natural things we could do.
Absolutely.
Are humidifiers this time of the year, Doug, a necessity in our homes?
Very helpful. Yeah. Very helpful. So I think that's an important thing.
How about medications? If it advances to the point I need to go see the doctor and go to the pharmacy and pick something up?
In most cases, it's helpful to use I would even say that sinus rinse is still a type of a medication. So using that first would be a sinus rinse would be a good choice.
That you could make yourself at home.
That you can make yourself at home. Some people will even use a home recipe where they'll use a teaspoon of bicarbonate of soda mixed with a teaspoon of canning salt and a liter of water, and that type of a thing is very helpful. There are also some commercial. Any drugstore you go to will have sinus rinses available commercially. Other medications that are helpful, especially in the evening, many of the things you see are decongestants or antihistamines. People with high blood pressure, though, have to kind of be careful about decongestants.
Read the label.
Absolutely.
If you have high blood pressure about using these
Absolutely.
Dr. Barnes, are you a kind of physician you will see a patient and you would say, we need an operation for you on this?
Not eventually, but frequently not. Most types of sinus disease don't require an operation. There are operations available, but
you'd screen those patients, though.
Absolutely.
You'd take a look at them.
Absolutely,
But so it would be very rare to need a sinus surgery?
A small percentage of the patients that I need surgery, probably less than 5 or 10%. But those are people that have what we typically describe as chronic sinusitis. So if someone has an infection that becomes more of a bacterial infection, and that lasts for 3 or 4 weeks, then that is where we start thinking about other types of medical treatments, and that may go on to a type of sinus surgery, different types of
and Doug, what is the procedure like when you feel you need to do that for a patient?
There's lots of different new technology involved in sinus surgery. When I was in training, which has now been, I've been in practice a little over 20 years. When I was in training, endoscopic sinus surgery was a fairly new type of procedure where we would go in with little scopes, and we still use that. Even recently, there's been a little bit more advancement in even more minimally invasive types of procedures where we actually use little balloons in the sinuses. They're similar to what one might use if you think about angioplasty, where an artery is
sort of
ballooned.
an angioplasty for the sinuses. You completely do that procedure.
Correct. Yeah, and that's a new type of procedure now. Not everybody is a candidate for that. There are certain types of anatomy or certain things we might see in the office where someone is a good candidate for that and others
maybe not so good.
Maybe not so good.
Right,
maybe more traditional sinus surgery, depending on whether there's large polyps or inflammatory change in the nose.
We are with Dr. Douglas Barnes on HealthWise, the TV show from Topeka Ear, Nose, and Throat. Doug, I believe we talked about what we do inside our homes and for the outside. Are there some lifestyle changes we need to make over the wintertime? The air now it's so cold and so dry.
Yes, yeah, I think that's important. I think we talked about home humidification. There's a lot of other things to be careful about during the winter. I still think you need to worry about allergies as a cause of sinus trouble. And in the winter, you have a little bit different allergies than we do in the spring and fall. In the springtime, early spring, we see a lot of troubles with tree pollen. Late spring, we see mostly grass. But we have some year-round things that we have to deal with, things like mold and things like dust. So making sure that our homes are clean and trying to remedy and decrease dust as much as possible in the home is very helpful as well.
But you have your team of allergists, of course, at Topeka Ear, Nose, and Throat, and then the people who might do the procedures and specialize in the sinuses.
That's correct.
All that right there.
Yes, so we can test for allergies if necessary.
Right. When is it time for our friends at home, if they go, I'm having all the things Dr. Barnes is talking about, time when they know it's time to go and see Topeka Ear, Nose, and Throat?
I think it's important initially to try to do a lot of self-care and home care. And for example, if one has a viral upper respiratory infection, it's important to try to not seek out antibiotics initially. We're seeing so many resistant bacteria that it's really important to not initially go for an antibiotic. And so I would wait typically a week or 10 days, maybe even 2 weeks after a viral infection for one seeks care. Often one will initially see their own primary care physician first and then see us after that.
All right. The number to call is 233-0500, and they also have offices not only in Topeka but Emporia, Lawrence, Junction City, and my goodness, 9 other satellite locations around northeast Kansas. Dr. Douglas Barnes, thanks for the advice and helping you breathe easy with possible sinus problems, and appreciate you being on the show.
Thank you very much.
Time now for our exercise segment featuring some fun, invigorating, low-impact exercises. And check with your doctor before you start this or any other program.